Hi, everyone. I think there's one person on. Oh, there's a few people on now. We'll get started in just a minute. I want to wait a few minutes to kind of give everybody a chance to log on if they need to. All right, we got a few more people logging in. Thanks for joining us today. I'm going to get started in just a few minutes and we'll be talking about social media and mental health in kids. I haven't done a Facebook Live event in a while. I'm trying to see if I can see who all is on to see if I know any names, but I cannot see it. So, all right, we've got a few more people logged in. I'm still going to wait just like one more minute for other folks to join in so we can talk a little bit more about social media and mental health in kids. All right, let's see. Well, I will go ahead and get started. I'll introduce myself so as folks are coming in. I'm not sure that I can see any of the questions, but I have a DNP student on with me and she can just go ahead and, oh, I can see comments. So if anybody, oh, I see comments now. So if you guys have any questions, please feel free during this event to go ahead and post them in the chat. But just to get started, my name is Liz Hudson and I'm a psychiatric mental health nurse practitioner. I've been working with the pediatric population for most of my nurse practitioner career and my nursing career. Currently, I'm the program director of Texas Tech's Psych Mental Health Nurse Practitioner Program, but then I also practice part-time at a adolescent boys residential facility. Prior to this, I've worked in intensive outpatient programs, partial hospital programs, inpatient, outpatient, large children's hospitals, small private practices, kind of across the full gamut. I first became interested in the intersect of social media and pediatric mental health when I was working as an RN on a child and adolescent inpatient unit. Now, this was 15 years ago, but even back then, I started hearing about, children becoming suicidal based on posts that they saw online, or they would sext a picture, it would get kind of sent out everywhere, and that would cause suicidal ideation. We started hearing about a lot of problematic behavior online with predators and different things. But then the thing that I noticed is that kids would come in and they would tell me things like, well, all my friends hung out without me this weekend. And I'd be like, well, how'd you find out? Well, they all posted about it online. And this is a common thing now, but this was kind of a big deal 15 years ago. So hearing about this and hearing about kids' struggles with depression and anxiety really made me want to research this a bit more. So, since that time, I've continued to see teenagers and inherently their parents, and I've learned quite a few things that I'd like to share about social media and mental health. I also like to acknowledge at the beginning of these talks, I am not cool and I am not hip. And I am not here to teach you about social media because I don't think I could even do that. Tara from NapNap had to kind of teach me how to get on Facebook Live today. But I am here to tell you, as a provider and as a parent myself, what are some of the things that you should know and be aware of? So I think it's important to disclose too, along those same lines, I'm a parent of 3 young children. And so I think that it's so important for all of us to know, even if we're parents slash providers, what should we be doing related to our own kids, social media, screen time, and all of those different things. And then the funny story I like to add is my kids' school canceled today, so my kids were using a lot of screen time, and even some of them are down using it right now, so I could give this talk to you guys. So I also come from a place of no judgment. We all are doing our best to survive out there and raise our kids, and I hope to share some practical, helpful tips for everyone. Okay, so the first question that I think a lot of parents and other folks ask me, like to think about, okay, how old should my kid be when I get them a phone, let them join social media, and different things like that. And this is a really difficult question to answer, right? So, when we think about getting a phone or social media, there's a few things that you need to consider. There's not a perfect age for me to say. You do need to consider the individual child, their maturity level, and their ability, their kind of openness and communication in talking to their parents or providers, whoever it may be, about what they're seeing online. A lot of platforms, Instagram, Facebook, etc., do have a requirement that the users be at least 13, but there's not a lot of like age verification checks that actually happen. So most of the time, anybody with an email can sign up for most of these things. So even before parents want their kids to be signing up for it, kids might be signing up for some of this stuff. The American Psychiatric Association, American Psychological Association emphasize developmental maturity matters more than that chronological age, right? Children should have a pretty good ability to emotionally regulate and social skills before using social media, because it takes us all those social skills as well. And parents should really assess that readiness on an individual basis for their own child. Another question, I'm going to kind of frame these as like frequently asked questions, because these are the ones that I get from parents. How much time should my child spend on social media each day? So the American Academy of Pediatrics has put out some really awesome screen time guides for kids and adolescents, and they do give more specific instructions. I'm going to have a hard time quoting it now, but I want to say under 18 months, they really say no screen time, or maybe it's even under age 2. And then 2 to 5 is like 1 to 2 hours a day. And then it increases with age. But something that I think we should focus on even more than just the quantity, the amount of time that children watch, we should think about the quality of what they're doing online. So what kind of like shows are they watching? So I can tell you, I have young kids still, so we really focus on PBS. PBS is created by folks with like children's developmental kind of aspects in mind. Other things that you might find on YouTube, there's a lot of like individual like influencer created content, which they might not be taking children's developmental needs into consideration. So in general, I think YouTube is probably not a great place to be unless you are sitting there with your child looking at things. My kids and I might sit there and we might look up like specific animal videos together, or before we go on vacation, we'll look up like different bloggers posts on different vacation ideas. So it's not to say that like some of these platforms are off limits, but just they need to have a bit more supervision. And then other things to kind of think about. So something that I like to consider is social media is different than TV shows, right? Because social media is interactive, it's back and forth. So you need to really assess your child's readiness for social media and their ability to handle the likes, right? And the comments, because that's a really difficult thing. They're putting themselves on this stage for other people to judge and comment on and like and not like. And that's really difficult for young children up until a certain age to really kind of figure out how to work with that. So there have been some different organizations that say no social media, like Instagram, like Twitter, like Facebook, the ones that have the back and forth, the likes and different things, until age 13. And even at that point, you want to make sure that you have a good plan as a parent to talk to your kids about it, how to use it, what are the limits around it. So I hope what you guys are hearing from this is that it's really balanced used. It's not to say that social media is good. It's not to say that social media is bad, but it is to say that it's something we need to have balance in. So what are the problems of social media? That's a question that I get. Like, isn't it going to harm my kids if they're on it all the time? So the research is mixed, right? And I think the big thing to remember is that social media is here to stay. we're literally on Facebook Live doing this event. My student who's here, we had a kind of funny email exchange of figuring out if we had the like certain Facebook setup, and we were both saying we use Facebook for Facebook Marketplace and to track like kids group, like social groups for like parents and things like that. It's a necessary evil, right? Even if we don't want it. And it's going to be a necessary evil for our kids too. So let's teach them, let's give them training wheels of how to use it. So anyway, though, back to the original point of like, what are the problems with social media? So excessive use has been linked to a number of mental health problems. Some of those include self-esteem issues, disordered eating. Certainly the two big ones that research has really shown a definitive link between is excessive screen time and sleep issues, and excessive screen time and obesity. Screen time and sleep issues are really just regulated through the melatonin synthesis, right? Like back when we were cavemen and we used light to tell us when we should be awake and when we should be asleep. Now we have these screens in front of us, like right before we go to bed, and our melatonin is kind of out of whack. And so that's what I describe to people is that, I get that we're all doom scrolling before bed, but we really want to role model to our kids and teach our kids to not do that, because that will interfere with the quality of your sleep. The next one, obesity, that has to do with mindless eating and ads that have to do with food. I felt like even a few years ago, we were all pretty lucky, right? We were in the age of like a lot of the different streaming platforms didn't have ads, but now they're all starting to introduce them unless you have the paid version. And so now we're back to, kids seeing ads for McDonald's and all the different things, which then causes hunger, then causes eating. And so that's how the link between screen time and obesity. The other thing I want to emphasize that most of the research has looked at excessive amounts of social media time. I am not here to say that if you use social media or if your kid uses social media that there will be consequences. That's not the case. It's not a black and white type thing. It has a lot more to do with the excessive use. So what are some of the things to really look out for? You want to consider, are kids having social withdrawal or irritability when they're not online? Are they having trouble disconnecting? I will say a lot of kids have trouble disconnecting. Social media, screens, TV shows, all of it, it's entertainment, right? So we enjoy doing it and it's hard to switch off. One thing that has been proposed that I like to share with parents is helping a child transition away from social media, away from screens, whatever it may be. So giving them, a 10-minute warning and say, we're going to stop and we're going to do this. So, it's really difficult for a kid to hear, turn the TV off. But instead, if we kind of give them that transition of it's going to be another 5 minutes and then we're going to do this, so they know what to expect. So what are some of the other warning signs that it's kind of an unhealthy relationship? Using social media at the expense of sleep, physical activity, or school. This is a new question that parents have been asking me about recently are like smartwatches in school. Well, don't I need to be able to get a hold of my child? So the hope is that, if there's a crisis, if something's happening, the school is going to put out the mass communication to parents. So in theory, there aren't a lot of needs for kids to get a hold of people while they're in school, right? In a normal circumstance, not in a crisis. I'll tell you, I can just share the rule with my daughter is she can have her watch, but she has to leave it in her book bag. And then after school, because she has some after school activities, she can get it out. But I know, you've all seen it, when you've been talking to someone who has a smartwatch and they look down while you're talking to them. And so the risk of distraction is it's really there. And I don't think that kids know how to mitigate that risk of distraction yet. So I would say you need to have the places where screens, phones, social media should not be used, and school is one of them. But kids don't have a great way of filtering when they should and shouldn't use it, right? They're just impulsive little beings. So that's where we do need to come in as parents, adults, and kind of, provide those boundaries and limits of when they should and shouldn't use it. Back to the kind of risk factors, signs that there's an unhealthy relationship. Emotional distress related to posts or interactions online. Certainly, if something negative happens, if bullying happens online, it's appropriate for someone to have an emotional response to it. But sometimes people get sucked into the drama online the same way that kids can get sucked into the drama at school. So helping them figure out, what's real, what's not real, and talking to them about that. Constantly checking or inability to stop scrolling. Doom scrolling is kind of the popular term for that, when you're just like scrolling endlessly and you can't stop. So teaching kids how to stop that and when to stop that. It's really important to teach parents, and if you're a parent yourself, to not just say, shut it off, turn it off, whatever, to give that alternative. Help them problem solve in the moment, because their brain is so sucked into that screen. So help them figure out, what's my alternative? I always think we're really good as providers at teaching parents how to work with a toddler, right? Like, you give them two options. You can't just give them unlimited options. They're toddlers. Sometimes our kids need that when they're sucked in online. They need that concrete, okay, we're going to turn it off in 10 minutes and we're going to go eat lunch. Let's see. So we've talked about some of the negative things about social media. And I think that when we talk about social media, mental health, there are a lot of negative things, right? But there are some positives. So let's talk about those now. One of the positive things that I see about social media is it provides an outlet for marginalized groups. For kids who don't fit in school, they might be able to find a group online of friends who are similar to them. This is something that we've seen definitely with like LGBTQ individuals or other, like I've had kids who have rare medical conditions who find a social media group for other kids with that same rare condition, and then they can connect. And isn't that such a cool thing to build that sense of, you're not alone? Social media is important to teach them about the world. As I was mentioning, like in my family, we use YouTube for certain circumstances. YouTube gets a pretty bad rep because it's not really edited by anyone, right? It's just posting videos, so anybody can post anything that they want. So use YouTube at your own discretion, but we watched YouTube videos before we went on spring break last week, and I was showing my kids videos of Arizona before we went to get them excited about it, to prepare them for what we were gonna do, and it helped to give them some ideas of, ooh, I really wanna do that. So let's see, just a few more questions that I get from parents a lot. Let's talk about parental control apps and what kind of parental control you should have. So I would say before your child gets any kind of screen, device, downloads an app, you need to have a conversation with them about it, about what kind of rules and boundaries are. If you only hear one thing that I say today, I want you all to look up the American Academy of Pediatrics Family Media Plan. I'm gonna see my student is on here. Do you wanna put that in the chat if you're there? Or I don't know if I can do two things at once and try to post it, but I will definitely post that link for you at the end. The American Academy of Pediatrics Family Media Plan is an amazing resource where the entire family is supposed to sit down together. It filters it out based on your child's age, developmental level, and then you click on the rules that you want to pick for your family, and then you can customize them. So again, I have 3 kids. Each one has a 1-page, oh good, the link is there, wonderful. Each one has their own family media plan based on their age and things that I know about them as a parent. I know my oldest child, the responsible one, is able to turn it off. My middle one needs that transition time, and my youngest is 2, so he has, it's a free-for-all. But then it also helps you as parents to put rules and limits on yourself, because it's so important for us to role model for kids. We need to be able to show them that maybe dinner time is a screen-free time. Maybe before bed, an hour before bed, we all put our devices in one place and say that they're going to charge downstairs or whatever it may be. So you want to role model these things to your children as well. So that family media plan, it is amazing at helping you to give you lots of different prompts that you may not even think about that are important things to consider. So should they have it at school? Should they not? Should they, or it even helps you to think about, like, if there's a violation, they abuse it, whatever, how can you effectively take it away? Because it's really hard to just say, like, no more social media. I hear parents tell me that all the time. They're like, I just took it away. And I'm like, well, they're going to go to school. They're going to use their friend's phone. They're going to log on. They have to use computers for homework. It's very difficult to ban it. So instead, it's better to have these rules in place, but then have concrete ways that you're going to be able to take it away, or limit it, or whatever it may be. So again, AAP, Family Media Plan. So then back to like the other parental apps. There's a lot of them out there, and this changes. This is one area where I do think it's hard to keep up with as a provider, especially, like, which ones should you recommend? Most of the research that has been done, because these apps change so quickly, and because a lot of them are paid, and it's hard to do research studies on them, there's not great research out there. But what most of the research does actually talk about is that maybe we should be, like, kind of figuring it out and learning about these apps on our own. So we want to have the family media plan from AAP. We want to have that in place. But then we want to teach our kids and teenagers self-regulation when it comes to social media. The reality is they're going to be out on their own someday, or they're going to be in school. They're going to be in different places where they're going to have to learn how to regulate themselves on social media. So rather than just having, the Big Brother app that's watching everything that they do, instead, it's better to have open conversations with kids about it. Now, this is kind of my advice for the general population. What if you've got a kid, or you have a parent who comes to you as a provider, and that person has already had a lot of problematic use? What are some of the apps out there? Like Google has one. There's one called Bark out there that's got a lot of parent support. And ironically enough, one of the things that I recommend are there Facebook groups for parents on, like, the latest and greatest kind of parent monitoring apps out there. And that tends to be what I've looked towards when I've wanted to have recommendations myself for parents. So, there's differences if there's problematic use versus just the general population. Let's see. Oh, this is it. I had a question from a parent once of, like, should I have my kids' passwords? What a great question. This one goes back to like knowing your individual child and their, like their limits and different things like that. I am here to say that this is just an individual parent decision. You definitely might have a kid where you need to have access to it, but maybe you talk to them about, like, I need to have your password in case of an emergency. But I am going to promise you that I'm not going to log into it to snoop on you to do other things. I think it's important for you to have your own space. But if I need to, if I'm concerned about you, if something happens, then I do need to have that password. So that kind of tends to be like this spiel that I give to families about, like, if they should have access to these accounts. The other thing that I know as a mental health provider is sometimes kids will use social media as a cry for help, or they'll post online that they're suicidal, they're cutting, and different things like that. And so that's when I do think it's important for parents to have access to that stuff so that, they can be aware. I've heard too many sad stories of parents finding out from a friend's parent that the kid posted online. Let's see. I haven't seen any questions come in, but also Let me know if you guys have any questions or if there's any things that I haven't covered that you think are really important to consider with social media and mental health in kids. Oh, you know what? Another resource that I want to share. I'm really big on resources because I want you all to walk away with some practical tips. So, Common Sense Media, I'm going to see if my student can post that on there, or I tried to share it, but it might not be there anymore. Common Sense Media is a really great website. They have all kinds of different sections of it. So they have a parent's guide depending on your child's age of like things to consider, rules, limits, all that kind of stuff. They used to have a social or a family media guide, but I think AAP kind of took it over and posted most of that. Common Sense Media, though, has ratings for most TV shows, movies, video games, and different things like that. And that's one of the things that I, as a parent, use frequently. Again, my kids have been off school for a few days, so there was a lot of screen time happening. And one time when I walked through, I'm like, that's a show I haven't seen before. What's that show? And so the quickest way that I like look up what that show is Common Sense Media, because I know that it's been verified by like social, like screen experts, and they can tell me like what age the show is appropriate for, what the content is. It also gives like different ratings. There was a show about zombies that my daughter wanted to watch, and my husband was like, no, it's about zombies, it'll be too scary. But I was able to look it up on Common Sense Media and say like, actually it's, for ages 6+, like it's probably okay, it's whatever. All right, so we have a question. Any thoughts on screen addiction? Yes. So I brought in my student, Stephanie Metters, who's been commenting, because she actually did a project on social media addiction. So here's the tricky part. So first, here's my provider spiel. There's no official diagnosis yet on social media addiction. It's not in the DSM, it's not in ICD. It's being talked about a lot more in other countries because video game addiction is like a really big thing in some of the Asian countries. So it's getting talked about, but it's not an official diagnosis. It's not something that we can code yet or anything like that. But is it a real thing? I would say that social media addiction is probably going to fall under other types of addictive behaviors that we've seen, like any kind of substances, gambling. We know that there's sex addictions, things like that. What it all has to do with is the neuroscience of, what's happening to our dopamine when we're doing something that's very pleasurable. And so our brain is going to tell our body whatever it needs to do to get back to that pleasurable event. I mean, that's the whole neuroscience in a nutshell behind addiction. And social media can have that same effect of like that dopamine hit. So we see that especially with kids when we're seeing just like endless doom scrolling, inability to shut it off, when it's interfering with their functioning. So we can't yet call it, you can call it that, but it's not an official diagnostic label, but it is something to be mindful of. And that's when we as providers really need to intervene with the parents and kind of help them to figure out how to balance it out when we're starting to see those behaviors. Yeah, that's a great question. Any other questions? I kind of look through my notes and see what other things I commonly get asked by parents. Oh, another thing that, I know a lot of you out there work with schools and help them figure out like what kind of things they should be talking about. Common Sense Media has a lot of different material on digital citizenship. So we all know we have to teach kids how to be good citizens, right? But how do you become a good digital citizen? Common Sense Media has like different courses. And in fact, my kids' elementary school, the computer science teacher uses Common Sense Media. I was like so thrilled to see that. She uses it to teach kids about like how to create a password. What's a good password? Where do you keep your password? How do I take care of my screens? Like some of the beginner, my kids are young, so the beginner steps, but it goes all the way through the teen years or like of what you should think about, like not sharing your location, being cautious with what photos that you share, helping them to understand that things posted online are there forever. Let's see. I think that those are a lot of the important things that I wanted to talk about. The last thing that I really want to end on, it does have to do with social media addiction and adolescents, children being this more vulnerable population. I think a lot of what I shared, you guys could probably take that and like extrapolate that to adults, right? Like everyone needs to have limits on social media and boundaries and all the different things. But what makes adolescents in particular more vulnerable than other populations? So we know that the frontal lobe that has to do with our thinking, organization, planning, it's not developed until, later in adolescence. There's even some studies to say that it's into the 20s, 30s, whenever it may be. So it's not really there. And that's where we see a lot of impulsive behaviors, poor decision making, and some of the things that we see in adolescence. And that is true as well when it has to do with social media. So neuroscience has really helped us to illuminate how the adolescent brain is more susceptible to social media addiction because they have a heightened sensitivity to social cues. There was one study that was fascinating, came out a long time ago, where it looked at kids, like the connection between the frontal lobe, thinking, planning, behaving, and the amygdala, our emotional brain, and those links in adolescence when they looked at a post online versus looking at someone's face when they say that. So there's a difference, right? When you post words online, you might get away with saying like a bullying statement or something mean or not nice or unkind, and it might be something that you would never say to someone to their face. So I feel like it's this difference of like their ability to filter out and know what you can say online versus in person. They have like that heightened emotional response, right? All right, another good question came in. My son's principal suggested he use social media more as an incentive to wake up earlier. I'm on the fence with that. So I would wonder if it's social media or like screens or something like that. Because it's hard to say. That's a hard one. If you're trying to get your kid up earlier, you do want to incentivize them. But that to me is the whole question of like, people ask like, should we incentivize? It's virtual reality. Thank you, that's helpful. But should we incentivize like potty training with a Skittle? Which I'm here to tell you, I'm literally using Skittles for potty training, and I did it with my other kids, and it's what worked for us. But at the same time, I also am very aware of the fact that I don't want my child to continue to think that we get Skittles. I don't want this conditional thing. So that's where I would be hesitant to use it, because you don't want them to like, what if you are away, don't have the opportunity for virtual reality to wake up? I think the other tough thing is before school, it's chaos getting ready in the morning, right? Like trying to get up. So you might get 10 minutes to do it. So that's where if you do decide to do that, I would probably consider like, okay, the rules around it are going to be, if you get up, if you are dressed, if you have eaten a healthy breakfast and your book bag is ready to go, you may, and there's time left over, you may have 10 minutes to play your game. Because again, remember, kids need that time to transition out of the game. So those are the rules that I would put around it if I were to use it. But I honestly think knowing what my house is like in the morning when we're getting ready for school, there's not a lot of time and there's not a lot of ability as a parent when you're getting ready yourself to kind of manage all of it. So I might try to see if there's another incentive that might help your kid get up in the morning a little bit better. Or maybe the incentive is, if you get ready and have a good day, when you get home from school, you can have 30 minutes, like kind of incentivize it in that way that you're not going to get it right away. But if we consistently get up in the morning and do the things we need to do, then you earn this. Yeah, exactly, Laura. That transition time, and I can share with you all. I know Laura and her son is my daughter's age, and I can tell you it's really hard to get kids off when, again, that's where that our brain and the dopamine, it's really hard to get kids to stop. So that's where I think it might be a tough one to use in the morning. In the American Academy of Pediatrics Family Media Plan, they actually ask about that, like screen time in the morning. And that's what I told my kids, no screen time in the morning on weekdays, because before school, because it's just too hard to get them to turn it off and go to school. And I don't want to send a dysregulated kid to school. So yeah. Has there been any research conducted that shows an increase in children-teen suicide in correlation? Oh yeah, tons of research. And that's where, again, when I was talking before about like excessive social media use, so let's talk about cyberbullying first. There's definitely a link between cyberbullying and suicidal ideation behavior and suicide. There have been so many just unfortunate and tragic cases out there that have occurred. So there's a definite link. The question that I have always asked as a provider is that link above and beyond traditional bullying? And that's where it's impossible to answer, because sometimes cyberbullying is a spillover of bullying that's happening in school. It's the same kids doing it online that were doing it in school. Sometimes it is anonymous people that the kid doesn't know, but that's less often than people that they do know. But then, does increased social media use correlates with increased depression and anxiety and suicidal ideation? Is it a direct cause? I don't know about that, but it probably is more linked to increased social media use. Too much social media use leads to self-esteem problems, leads to anxiety, leads to disordered eating. So there's probably many different factors going into it, but the simple answer is yes, too much use does correlate to that. Yeah, somebody said recommendation to give screen time after finished chores, homework. And that's, again, I can't speak enough to the AAP social or family media plan. It gives it helps you create those rules in your home to say when screen time can occur, when it cannot occur, and different things like that. And I print it off, and we all know nobody has printers these days, but this was one thing that I'm like, I will print this off, I will figure out my printer, and I put it up on the fridge. So we all are aware of it. And you know what? Every once in a while, my kids catch me using social media at the dinner table or something. And so it's a good reminder to everybody that we all have to catch each other and hold each other accountable. Yeah, great tip. Any other questions about social media and mental health? Thank you all so much for coming. This was such a great discussion. This is something I'm so passionate about as a provider, but also as a parent myself. And I think that there's a lot of bad out there. There's some good, and we've got to figure out the best plan that we can for our kids. So thank you all so much, and have a wonderful evening. Yeah, I'm going to try to share. I know I set up a bunch of other resources. Stephanie, do you want to try to share some of the other resources that I had? Oh, here we go. Here's one on keeping teens safe on social media. AAP, then the next one I'm going to share, I'll just share it right now. AAP has a Center of Excellence on social media. This is a great one as a provider to check out if you want to learn more. They have tons and tons of resources out there. So, all right. Thank you all so much, and have a wonderful evening.